Welcome to the 12th module of Program on Implementation of NABH Hospital Standards, that is, Patient Rights and Education, where we shall talk about the 8 standards of PRE and their 53 objective elements. At the end of this module, you will be able to understand PRE 1 standard, PRE 2 standard, PRE 3 standard, PRE 4 standard, PRE 5 standard, PRE 6 standard, PRE 7 standard, PRE 8 standard.
Namaskar. Greetings from NABH. Now let us look into the intent of Chapter 4 of 5th edition of NABH Healthcare Organization. Greetings from NABH. Now let us look into the intent of Chapter 4 of 5th edition of NABH Healthcare Organization Standards, that is Patient Rights and Education, or PRE. The intent of PRE chapter is that the organization defines, protects, and promotes the patients' and family rights and responsibilities. These are promoted actively by various methods. For example, displaying the patient's rights at various patient care units and other prominent places in the healthcare organization. Also, the staff is aware of these rights and is trained to protect them. The staff should display respect to the patients and families' rights, and their conduct should reflect that by the positive and helping attitudes towards the patients and the families. Additionally, the healthcare organization can display their concern towards families and the patients by developing a mechanism to report the violation of rights of the families and the patients to the hospital. The organization may develop list of such instances which could be considered as infringement of patients and family rights, and then train the staff accordingly. For example, compromising the privacy, breaching confidentiality, disrespect to the religious and the cultural beliefs, not providing medical records within the stipulated time. All these are the infringement of the patient rights. Violation of the patient and family rights is reported through an incident reporting form by the internal mechanism, by the other staff. It could be provided, this particular incident mechanism can provide the details about what is the incident which has happened, where it is applicable, and by whom the incident has, this right violation has occurred. Also, there should be a mechanism for the patient and or family to report a violation of their rights. The patient's feedback form can be the useful tool for this by incorporating patients' rights to be worded rightly and appropriately. That can be a useful tool to capture the violation of patient rights. Apart from it, once reported by staff or the patients, these patient and the family rights violations needs to be monitored, analyzed, and steps for improvement in compliance are to be taken by the top leadership of the organization. Various patients and family rights are part of various standards and objective elements and are important to be implemented in the HCO. Be it the respecting values and the beliefs of the patients, spiritual needs, personal dignity, privacy, confidentiality of the patient information, or refusal to the treatment or right to seek the second opinion. All this should be part of the healthcare organization's patient rights and families list. And that list should be promoted and their implementation is to be adhered to. The patients and family members must be educated to make informed decision and should be involved in care planning and delivery process. For example, patient and family members are explained about the proposed care that includes the risk and alternatives and the benefits, outcomes, and the possible complications, if any, during the planned care. All these should be done in a language which patient can understand. All such education done should be documented and signed by the concerned doctor. Informed consent is obtained from a patient or a family for a specified testing or a procedure or a care. Be it HIV testing as per NACO guidelines or MTP being done as per PCP NDT Act, or organ donation counseling is being done as per Transplantation of Human Organs Act. All consenting process should be as per the law of land and should be adhered to the statutory norms. The consents needs to be procedure specific and should explain benefits, alternatives, and risk involved in the procedure in the language that patient understands. The consent should have the name of the doctor performing the procedure. In case the procedure requires more than one doctor or from the different specialties, then the same needs to be documented and explained to the patient. The consent shall include the name of the doctors or the main surgeons from each specialty which is involved in that particular procedure, and each doctor will have to explain his or her role to address all aspects required for the informed consent. For example, if the surgery involves the requirement of neurosurgeon, ENT surgeon, and an ophthalmologist, the consent should be reflecting the same. It should have the name of the principal surgeon of all three specialties. It is the responsibility of each of the surgeon or a team to explain their roles and benefits, risk, and alternatives of the procedures they are performing on the patient. So if it is a doctor under training, the same shall be specified, and however the name of the qualified and the supervising doctor should be mentioned. So training doctor, you have to mention that the training doctor is involved as a part of the team which is providing the care. The consent form shall be a minimum bilingual, and when consent is taken in a language other than what is the patient understands. So the language on the consent form is different from the language in which patient is explained to, then should be a clear documentation detailing the language in which the patient has been counseled, and if the interpreter has been used or not, that should also be mentioned. The consent should be taken from a patient in all cases when the patient is capable of giving the consent above the legal age for giving the consent. No one can consent on behalf of a competent adult. The organization should take into consideration the statutory norm where the surrogate consent is being taken when the patient is not capable of giving the consent. So this will include the next of kin or the legal guardian. The order of preference of next of kin or legal guardian or spouse or son or daughter or parents, all these should be as per the statutory norms. In case of life-threatening situation when patient is incapable and next of kin is not available, in interest of the patient, the treating doctor and another clinician who can decide to safeguard the patient's life can sign the consent. The expected costs of treatment and care are explained clearly to the patients and or family. The pricing policy in different settings like OPD, emergency, non-ICU, inpatient units, and ICU patient units. So there needs to be explained to the patient. So the tariff list should be displayed or should be readily available at the admission desk or the other registration counters as applicable. So patients are educated about the mechanisms available for addressing the grievances, and there needs to be a mechanism to capture the patient's feedback, including the patient satisfaction. All grievance and feedback needs to be analyzed as per defined mechanisms in a manner which is in stipulated time period. So in time-bound manner, it needs to be there. Last but not the least, the organization must have system for effective communication with patients and or families. To make effective communication, for example, principle of 7 C's can be implemented. These 7 C's include clear, correct, complete, concrete, concise, considerate, and courteous communication. So organization must identify special situations like breaking bad news, handling adverse events, or handling aggressive family or family of a expiring patient, or family with when you are addressing the complicated cases. So where enhanced communications with the patient and families would be required. So that list can be, or that situations can be identified, and the training to the staff should be provided accordingly. Organization needs to ensure that there is no unacceptable communication. So with this, I think the intent of fourth chapter of fifth edition of NABH SEO standard is clarified and will help all the people watching this video. Thank you. Have a great day.
Now we shall talk about PRE point 1. The first standard of PRE states that the organization protects and promotes patient and family rights and informs them about their responsibilities during care. There are 5 objective elements of standard PRE point 1. The first objective element is the commitment of an organization that patient and family rights and responsibilities are documented and displayed and made aware of the same. Second objective element is the achievement for an organization that patients' and families' rights and responsibilities are actively promoted. Next is core objective element which an organization has to follow. The organization protects patient and family rights. Next objective element is also a core element for organization. According to that, the organization has a mechanism to report a violation of patient and family rights. As per the last element, which is a core element, violation of patient and family rights are monitored, analyzed, and corrective or preventive action taken by the top leadership of the organization. Let's move towards the second standard, that is PRE point 2. As per the standard PRE point 2, patient and family rights support individual beliefs, values, and involve the patient and family in decision-making process. There are 12 objective elements of standard PRE point 2. As per the first objective element, which is a commitment of an organization that patients and family rights include respecting values and beliefs, any special preferences, cultural needs, and responding to requests for spiritual needs. Second objective element is a commitment that patient and family rights include respect for personal dignity and privacy during examination, procedures, and treatment. Like when the patient feels hospital authority is exposing the patient, photographs or video recording. Third objective element is also a commitment that patient and family rights include protection from neglect or abuse, like in the case of vulnerable patients. Next is core objective element which an organization has to follow. Patient and family rights include treating patient information as confidential. It should be according to statutory requirements. Next objective element is a commitment that patient and family rights include refusal of treatment. Another objective element is also a commitment that patient and family rights include a right to seek an additional opinion regarding clinical care. Next is core objective element which an organization has to follow. Patient and family rights include informed consent before transfusion of blood and blood components, anesthesia, surgery, initiation of any research protocol, and any other invasive or high-risk procedures or treatment. HIV testing should also be done. Let's talk now about the HIV testing in healthcare settings. According to NACO guidelines on HIV testing, the fear and apprehension that exists among healthcare workers in managing HIV infected individuals and AIDS patients is largely due to the minimal risk that exists of HIV transmission due to a needle prick or other sharp injury. Thus, the demand for mandatory HIV testing of patients admitted in hospitals or undergoing surgery, etc., is not rational. This demand is neither rational nor appropriate. A mandatory HIV test is no substitute for standard work precautions that need to be adopted for every patient in a hospital or any other healthcare setting. On the other hand, testing without explicit consent of the patient has been proven to be counterproductive in the long run. NACO guidelines on HIV testing. Let's look at the GOI's HIV testing policy. As per the policy, no individual should be made to undergo a mandatory testing for HIV. No mandatory HIV testing should be imposed as a precondition for employment or for providing healthcare facilities during employment. HIV testing should be carried out on a voluntary basis with appropriate pre-test and post-test counseling. Next objective element is a commitment that patient and family rights include a right to complain and information on how to voice a complaint. Next objective element is the achievement for an organization that patient and family rights include information on the expected cost of the treatment. Another objective element is a commitment that patient and family rights include access to their clinical records. This is mentioned in Indian Medical Council, Professional Conduct, Etiquette and Ethics, Regulations 2002. Let's talk about IMC Regulations Section 1.3. According to Section 1.3.2, if any request is made for medical records either by the patients or authorized attendant or legal authorities involved, the same may be duly acknowledged and documents shall be issued within the period of 72 hours. Next objective element is a commitment that patient and family rights include information on the care plan, progress, and information on their healthcare needs. And the last objective element is a commitment for an organization that patient rights include determining what information regarding their care would be provided to self and family. Let's move towards the third standard, that is PRE.3. As per the standard PRE.3, the patient and or family members are educated to make informed decisions and are involved in the care planning and delivery process. There are 7 objective elements of standard PRE.3. As per the first objective element, which is core element, the patient and or family members are explained about the proposed care, including the risks, alternatives, and benefits. Second objective element is a commitment of an organization that the patient and or family members are explained about the expected results. Third objective element is a commitment that the patient and or family members are explained about the possible complications. Next objective element is the achievement for an organization that the care plan is prepared and modified in consultation with patient and family members. Next objective element is a commitment that the patient and or family members are informed about the results of diagnostic tests and the diagnosis. Next element is a commitment that the patient and or family members are explained about any change in the patient's condition in a timely manner. And the last objective element is the achievement for an organization that the patient and or family members are provided multidisciplinary counseling when appropriate. Let's move towards the fourth standard, that is PRE.4. As per the standard PRE.4, informed consent is obtained from the patient or family about their care. There are 5 objective elements of standard PRE point 4. As per the first objective element, which is core element, the organization obtains informed consent from the patient or family for situations where informed consent is required. Second objective element is a commitment of an organization that informed consent process adheres to statutory norms. Statutory norms include taking consent before the procedure either on the day or the previous day, at least one independent witness signing the consent form, taking consent every time, especially for procedures which the patient has to undergo lifelong, taking a fresh consent for the new procedure in case the procedure has to be changed midway. Next is core objective element which an organization has to follow. Informed consent includes information regarding the procedure, its risks, benefits, alternatives, and as to who will perform the procedure in a language that they can understand. Next objective element is a commitment that the organization describes who can give consent when patient is incapable of independent decision making and implements the same. As per the last objective element, which is core element, informed consent is taken by the person performing the procedure. Let's move towards the fifth standard, that is PRE point 5. As per the standard PRE point 5, patient and families have a right to information and education about their healthcare needs. There are 9 objective elements of standard PRE point 5. As per the first objective element, which is core element, patient and or family are educated in a language and format that they can understand. Second objective element is a commitment that patient and or family are educated about the safe and effective use of medication and the potential side effects of the medication when appropriate. Third element is a commitment that patient and or family are educated about food-drug interaction. Next objective element is also a commitment that patient and or family are educated about diet and nutrition. As per the next objective element, which is a commitment, patient and or family are educated about immunizations. Next objective element is a commitment that patient and or family are educated on various pain management techniques when appropriate. Next element is a commitment that patient and or family are educated about their specific disease process, complications, and prevention strategies. Next objective element is a commitment that patient and or family are educated about preventing healthcare associated infections. Next objective element is the matter achievement for an organization that the patients and or family members' special educational needs are identified and addressed. Special educational needs identified. Patients and or family members are educated through counseling, use of printed material, audio-visual aids, etc. Let's move towards the sixth standard, that is PRE point 6. As per the standard PRE point 6, patients and families have a right to information on expected costs. There are 4 objective elements of standard PRE point 6. As per the first objective element, which is core element, the patient and or family members are made aware of the pricing policy in different settings: outpatient, emergency, ICU, and inpatient. Second objective element is a commitment that the relevant tariff list is available to patients. Third element is a commitment that the patient and or family members are explained about the expected costs. And the last objective element is also a commitment that patient and or family are informed about the financial implications when there is a change in the care plan. Let's move towards the seventh standard, that is PRE point 7. As per the standard PRE.7, the organization has a mechanism to capture patients' feedback and to redress complaints. There are 6 objective elements of standard PRE.7. As per the first objective, which is a commitment for the organization that the organization has a mechanism to capture feedbacks from patients, which includes patient satisfaction. While capturing patient experience, it should include communication with doctors and nurses, pain management, hospital environment, cleanliness and quietness, responsiveness of hospital staff, discharge information, communication about medications, overall rating of the hospitals. Next objective element is the matter achievement for an organization that the organization has a mechanism to capture the patient experience. As per the third objective element, which is core element, the organization redress patient complaints as per the defined mechanism. Next objective element is a commitment that patient and or family members are made aware of the procedure for giving feedback and or lodging complaints. Next element is a commitment that feedback and complaints are reviewed and or analyzed within a defined time frame. And the last objective element is also a commitment that corrective and or preventive action or actions are taken based on the analysis where appropriate. Let's move towards the 8th standard, that is PRE.8. As per the standard PRE.8, the organization has a system for effective communication with patients and or families. There are 5 objective elements of standard PRE.8. As per the first objective element, which is a commitment of an organization, communication with the patients and or families is done effectively. It focuses on the components of effective communication for all categories of staff. Second objective element is a commitment that the organization shall identify special situations where enhanced communication would be required, like breaking bad news, handling adverse events, handling an aggressive patient or family, talking to a family of a patient who has expired, counseling for a complicated intervention, etc. Next objective element is a commitment that enhanced communication with the patients and or families is done effectively. Its approach should be focused nature of the enhanced communication, potential communication barriers, and the preparation required to handle it, process to identify the communication barriers of a patient. Example, interpreters. Next element is a commitment that the organization ensures that there is no unacceptable communication. For example, abusing patients, hurting the religious or cultural sentiments, communicating with disrespect, etc. And the last objective element is an achievement for an organization that the organization has a system to monitor and review the implementation of effective communication through feedbacks from patients and other stakeholders. Let us now summarize what we have learned in this module. The organization protects and promotes patient and family rights and informs them about their responsibilities during care. Patient and family rights support individual beliefs, values, and involve the patient and family in decision-making processes. The patient and or family members are educated to make informed decisions and are involved in the care planning and delivery process. Informed consent is obtained from the patient or family about their care. Patient and families have a right to information and education about their healthcare needs. The organization has a mechanism to capture patients' feedback and to redress complaints. Where we shall talk about the eighth. Hello all, welcome to the 12th module of program on implementation of NABH hospital standards, that is patient rights and education, where we shall talk about the 8 standards of PRE and their 53 objective elements.